Thank you, Tayeba, and a very warm welcome again to our esteemed panelists. We've got a real mix, but I want to start with a big thank you to Mr. Riaz Fathiana, who's really leading this initiative from the front. He's championing it, he's supporting it, he started this, and he's been with us through this journey from the beginning. And I don't have words to thank him enough. So a big thank you to him. I just want to go back to early this year, March 2020. I think it was a day or two before the COVID really hit us and everything went into lockdown, where we first met in Islamabad for our all-parliamentary mental health summit. So for those of you who were not present on the day, I just want to briefly recap that we had a first meeting at the Pakistan Institute of Parliamentary Services, where we met as a group. And this group that's meeting today is the group that is working on preconception, pregnancy, and mental health. And then we had the official inaugural of the summit at the President House. It was hosted by the President of Pakistan, Honorable Dr. Arif Alvi. And as you can see in the pictures, that we had a fantastic audience from really influential stakeholders across the globe. We have been asked to develop National Mental Health Policy 2020-2030 for Pakistan and its implementation plan. We know that all United Nation countries signed to the SDGs, they recognize the SDGs, and Pakistan is the signatory as well. And Dr. Fathiana has already alluded that we're really not doing very good with achieving our SDG milestones. The work, the implementation plan, the strategy that we are developing will help Pakistan achieve its SDGs. There's enough strong evidence now to support that social factors influence mental health. Social adversities, poverty, natural disasters, difficult relationships, they all contribute not just to the prevalence, but to the severity of mental illnesses as well. As an organization, we work across the life course. So we've got a life course approach: preconception, pregnancy, postnatal, early childhood, young adults, working adults, and older adults. So we've taken a similar approach for our strategy and implementation plan as well. Can we have the next slide, please? So some of the themes, there was a very interesting discussion during our first meeting, and some of you who were there would know that we overran and really we had to rush to go to the President House. But some of the themes in terms of problems that were identified were around child mortality, healthcare budgets, and a lot of discussion went around the lack of evidence during the preconception period, lack of awareness. Early marriages, again, were a biggie, and it was very topical. We spoke a lot about the early marriages. Next slide, please. And again, we discussed solutions. It was around, we need to refocus on the cultural research needs, building the capacity of our members of government, involving the government officials in the initial meetings and in these implementation plans, scaling up parenting interventions, students, raising awareness of mental health in students was also discussed in quite a bit of length. Next, Tayeba. So when we look at the evidence of social factors that influence mental health, I think the work that's been done by Lund et al. Is fantastic, as they've developed a conceptual framework of these social factors. And what they've done is they've aligned these with the different SDGs. Can we have the next slide, please? So they have divided this in 5 domains of social factors under demographic, economic, neighborhood, environmental, social and cultural. And like I said before, they've aligned them against relevant SDGs. Now, when we were doing this work, when we started with this work, we recognized that Lund has not used any SRs or any research evidence from Pakistan. So we started this initiative of evidence synthesis. So doing systematic reviews from research that's done in Pakistan so that we can understand these social determinants and its implications in the context of Pakistan. So what's going to happen next today is we have 5 different teams working on each of these domains as individual systematic reviews. So someone from the team will present, because this is just preliminary. We are continuing to work on it. And today is that they'll briefly present their findings so far. And then we'll have 7 minutes for each of these domains. And that's where we need our esteemed panelists to share their experience, their views, their thoughts. But keep in mind that we've only got 7 minutes. So a quick response, if people think that there isn't time, just put it down on the chat. And when we talk about in the end way forward, you will be hearing that this is not the end of our meetings. We'll have frequent email correspondences, and then we'll meet again March, April time. So I would request my colleague, Professor Hussain and Tayyaba, to please keep everybody on their toes, remind us about the time. Can we move